I am a virus, too. February 2, 2020, Reflections from a Delayed Awakening. In a small blessing amid misfortune, I realized on February 2 that it had been 14 days since my last trip outside on January 19. No fever, no cough, so it seemed I was in the clear. My coworkers and close friends were also safe, with only one high school classmate confirmed positive, according to updates on social media. Only at this point did I begin to regain my ability to think logically. Information surfaced a few days ago revealing that the virus had actually been circulating in Wuhan since early December, or perhaps even earlier. For more than a month, there had been no warnings, no precautions, while the virus spread unchecked. With the government giving no clear alerts, over 90% of Wuhan's residents were not wearing masks in public. The severe shortage of hospital beds across the city, even with the nationwide medical mobilization, was a direct consequence of the massive backlog of cases accumulated before January 23. Unable to receive treatment, countless patients were trapped at home, turning to the internet for help in desperation. Based on infection rates among Japanese nationals evacuated from Wuhan, it is entirely plausible that more than 100,000 people in Wuhan have been infected. Due to limited medical resources and delayed treatment, many patients missed their optimal treatment window and inevitably worsened quickly. Tragically, some will likely face fatal outcomes even if they are eventually admitted to hospitals. It has become clear that the officially reported death count is unreliable and likely far from the reality. Every day, stories emerge online of people who died at home without ever receiving a diagnosis. The grief and terror their families must feel is unimaginable. From initial shock to fear, I have now reached day 14 of the lockdown. Although I have passed the theoretical 14-day incubation period without fever or cough, I feel no relief. Without a thermometer at home, 2 weeks of confinement have left me with aches and stiffness. Physically, I feel far from well, and I don't have complete confidence in my own health. Right now, I don't think there's a single person in Wuhan who would dare claim they are safe from this disaster. Out of anxiety, I've started forcing myself to exercise at home, as reports repeatedly emphasize that a strong immune system may be our only effective defense against the virus. This is a genuine catastrophe, but it's not a natural disaster, it is a man-made one. Had the government made transparent reports and warnings when the virus was first discovered over a month before the lockdown, the number of infections in Wuhan would likely have been drastically lower. Among the millions who left Wuhan, fewer people would have traveled while carrying the virus, and those who did might have been treated sooner, or at least taken precautions like wearing masks if government warnings had been in place. If airports, train stations, and other hubs had implemented preventive measures, the odds of the virus spreading nationwide and even globally would have been significantly reduced. The people who have already lost their lives, and those who may still succumb, should be with their families right now, enjoying the new year together. Instead, they are separated by an impenetrable divide, and the loved ones of these patients, enduring the pain and terror of loss, are experiencing a horror beyond imagination. The term empathy feels hollow and almost nauseatingly inadequate in the face of such tragedy. Who could truly empathize with this suffering? Why? Why does China continually endure such man-made disasters? Yes, we know they lie, and they know that we know they lie. They even know that we know they're lying, yet they persist. If this weren't a life-threatening matter affecting every resident of Wuhan, including myself, perhaps we would have already become numb to this pattern of deception, neglect, and sacrifice. I, too, have grown used to it. For days, social media has been filled with desperate cries for help, the mourning of those who lost loved ones, and the grim courage of frontline medical staff. I don't deny that most people are fundamentally compassionate. Seeing this tragedy unfold around us is deeply painful for everyone. I've cried several times myself. But if it weren't for the fact that each of us now lives in constant fear worrying that the virus might reach us through toilets, pipes, elevators, garbage, or even aerosolized particles in the air, would my outrage feel as intense? Would it become a sustained drive for change, perhaps even action? I'm almost certain it wouldn't. Late on the night of February 6th, I saw the news that Dr. Li Wenliang, the whistleblower, had passed away. For the first time since the lockdown, I found myself lost in deep thought. I couldn't sleep. In the 2 weeks before, trapped at home, I had felt somewhat detached from this tragedy. Although I was shocked by the lockdown and the endless cries for help, I felt like a bystander, as if the unfolding disaster hadn't truly touched me. I thought only about protecting myself, trying not to add to the burden on our medical system. I even started a home workout routine, aiming to strengthen my immune system. For the first half of the month, I focused more on the thought that perhaps, by March, warmer weather would bring an end to this epidemic, allowing me to return to work quickly. Now, thinking back, I feel deeply ashamed. On the morning of February 7th, although dizzy from lack of sleep, I finally realized that this would be a long battle. I had to find ways to stock up on more food. And even if I couldn't escape this crisis, I felt compelled to leave something behind. Chinese people have short memories, including myself. In 2003, SARS took lives, left many with lasting health issues, and shattered families. Yet, the full story is now a blur. In 2008, the Sichuan earthquake claimed countless lives, and those memories have faded as well. This time, although people in Wuhan are all on edge, I predict that by late February or early March, the epidemic will likely reach a turning point, as indicated by official reports and rational analysis. Knowing how quickly people here return to normalcy, I expect life will be back to business as usual in 2 months. After such a worldwide shock, there will be accountability measures, but who will be held accountable and how isn't for us, the immediate victims, to decide. We are all accustomed to this by now, but this time, I refuse to be part of that silent acceptance. This time, I have to do something. February 11th, 2020.